Good morning, everybody. So, if your head feels too heavy for your neck, your swallowing stalls when you start, or your vision flutters when you turn your head, you very well could be dealing with craniocervical instability. So, that's what I'm going to talk about today on this Trauma Tuesday. Most people are told this is anxiety. It most definitely is not. Craniocervical instability, atlantoaxial instability, upper cervical instability syndrome, CCI, all synonymous terms, is a real problem with real biomechanics. I am Dr. Livingston, and I work with CCI every day. And here is some of the knowledge I have gained over the last decade plus. CCI is actually a spectrum. It's structural as well as functional. Oftentimes, I see those things combined together, so you don't get one without the other, and that is honestly the majority of the cases. So let's talk about structural. So we can have things such as bone or ligament failure up here at C1, C2. This can allow the junction of the upper neck to translate left or right or angulate, move too far forward or too far backward, and compress the brainstem, spinal cord, or vertebral arteries. These symptoms can be very severe. Now, let's take a look at the functional. This is, say we take these dynamic images, that's the DMX behind us. We take your lateral flexions left and right with your mouth open to check out, see if there's too much translation, or flexion extension, and that looks good. So a functional version would be where the hardware looks intact, those ligaments look good, but the control is noisy. So we have too much proprioception, there's drift. The deep neck flexors are underperforming, the global muscles brace, and motion becomes guarded and jerky. So you're going to turn your head and it just is super ratchety. People oftentimes have dizziness, brain fog, visual shimmer. That's the flutter when you turn your head. Heavy head. Always feels like you have to hold your head up. This is real physiology in action. Now we also have to consider hormones at play here. We have estradiol, progesterone, and relaxin. Those can all shift what is called viscoelasticity and our motor control. Pregnancy can magnify this. Menopause often trades laxity for stiffness. Contraceptives and hormone replacement therapy can help or hinder, depending on the person and depending on what the goal is there. And hypermobility, the effects can be amplified. Now let's talk about the TMJ, because a lot of the times this is involved. So the TMJ and swallowing. So a lot of times people with CCI will end up clenching, and they have joint dysfunction in here, which then raises the tone in the suprahyoid and the infrahyoid, and that causes issues with the sling. You can't see it because I have this awesome beard here, but it causes issues with the sling at the bottom of the neck, which then is tethered to the hyoid and the larynx. So this can be, when you have this all clenched up, this can be the pausing or the chug when you start to swallow. Jaw mechanics and neck posture, there's a lot of chatter there all day long. Now, so where this can get missed, like here's the nuance. In a normal supine, which means you're laying on your back, MRI does not rule out dynamic failure. Upright flexion and extension can also miss it as well. The real tail of the tape is the majority of the ones I see is the open mouth view, where you have your mouth open and you bend your head to the left and to the right, and you can see that C1 translate too far on C2. That totally can be a game changer if you have CCI. So that is very important and a subtle nuance that we need to acknowledge. So let's talk about progression. Without guidance, the body's going to splint these areas. Short term, it feels safer for the body. Long term, it costs us our endurance, increases pain, and adds sensory motor noise. Some comorbidities that can also matter: pregnancy, your age. It's just one of those things that has to be taken into account. That can accelerate the degeneration. Our aim is to, if you do have this, is to figure out where you are, if you're functional or structural, and guide our treatment based on there. It's to help you restore control and capacity in a functional manner, help coordinate the neck and jaw, and respect where you're at with, if you guys are on hormones or anything like that. Begin to loan gradually. Sleep, so important for this. You have to get your sleep under control, which helps regulate your autonomic nervous system, which are your sympathetics and your parasympathetics, your fight, flight, or freeze portion of the nervous system, and the rest and digest. There isn't one protocol per se for this. A lot of times people will take a multifaceted approach, whether that is using, let me see, the magnetolith, that's kind of that white box sitting over there in the corner, the cold lasers, the hot laser, the hyperbaric chamber. We kind of got to tailor this individually to what is going on. So if you guys and gals have any questions or comments, please drop them in the video below, and I will answer as many as I can. Have a great day. See ya.